My name is Danielle Mongold, and I'm from the same building as Dr. Shell, the health center, Deweese Health Center. I work in the insurance and billing department, and just want to talk to you very briefly today about some of the services we offer at the health center other than psychological services. We have a general medical clinic, so if you're sick, you're hurt, you can make an appointment, urgent type things. We take some walk-ins. There's also a women's clinic that's on the second floor near psychological services. We have physical therapy. There's a pharmacy on site. We also do lab and x-ray, so we really do offer a wide range of services, and it's conveniently located on campus. We're on Eastway Drive, catty corner from the Eastway Center, right behind the ice arena. Very easy to get to. Cost of services. If you have private insurance, we bill like any other doctor's office would. We take your copay. If you have a deductible or there's anything else your insurance doesn't cover, you're responsible for those charges, but it's really same as though you were going to any other doctor's. If you don't have insurance or insurance is out of network, we have a very low, affordable self-pay rate for students. So if you come in, don't be worried that you don't have insurance. We can still see you, and the office visit charge is very minimal, usually between $15 and $50. And then other tests or anything else you would have done, an additional charge, but again, very reasonable prices. If you have the student insurance, which I'll also talk briefly about, that covers you at the health center 100% for any covered services. You still have your prescription copay. And speaking of the student insurance, we do have a brand new company this year that we're working with. We have United Healthcare Student Resources, and I'm going to have a table at the resource fair right after this is over. If you have any questions about the student insurance, I'm happy to answer any. Basically, it's a student insurance plan. It's about $2,000 per year, but if you have a graduate assistantship, the university pays for 70% of your insurance. So it comes out to be only $622 a year for GAs. Great deal, covers you 100% at the health center. Coverage outside of the health center is comparable to most plans, 80% after you meet your deductible if you go in network. Like I said, if you have any questions, I'll be at the resource fair. A couple other quick things to mention. Immunization requirement. All Kent State students are required to show proof of their MMR vaccine. You have to have 2 doses of the MMR vaccine. Also, international students, depending on what country you're from, you may need to show proof of a negative TB or tuberculosis test. If you have any questions about the immunization requirements, I can answer those too. You can also stop over at the health center and talk with a nurse if it's a more complicated situation, you're not sure if you met the requirements or not. If you need any of these immunizations, we can always provide them at the health center. The MMR, if it's not covered by your insurance, is about $80. TB test, it varies depending on what you need. Just a skin test is only $20. If that's positive, you may need other testing. And last thing I want to mention is just the excuse policy. The health center does not provide excuses for missed classes or missed work. So keep that in mind, both for yourselves and if you're TAs for your students. If you are ill and you miss any class or miss any work, make sure to talk to your professor. Try to discuss that ahead of time before class. Make up for any missed work. Attendance policies should be addressed in the syllabus. But don't, send your students over to the health center expecting them to get an excuse for anything that they miss. And if you need to come to the health center, try to schedule it around your classes to make sure you don't miss any. We know that's not always possible. If it's an emergency, something urgent, you can come right over, but still make sure to contact your professors. I think that is about it. I'll see you at the resource fair if you have any questions. Thank you.